been 2 years ago.
Hello.
Hi, Dr. Beachy.
Hi.
I'm Dr. Rich. This is Deb. I wanted you to come and meet
Hi, Deb.
Deb.
I'm Dr. Beachy. Good to meet you.
She's here today because she's having some trouble with managing her diabetes.
Alrighty.
She knows a lot about the disease, but feels that some of the stressors in her life over the past 2 years have elevated. So she may
Alright.
benefit from some new skills from working with her emotions.
Okay.
She lost her husband several years ago, and is getting back on her feet.
Okay.
She's got a good job that she likes.
Alright.
But I would really look forward to hearing what you two come up with.
Okay. And so we want to, make a plan to help her take care of herself.
So I'm going to let Dr. Beachy stay with you.
Alrighty.
Okay.
Thank you.
Thank you.
Alright, so like we said, I'm Dr. Beachy. I'm one of the behavioral health consultants.
Mm-hmm.
I'm a psychologist by training, and my job here is to help patients become as healthy as possible.
Okay.
All right, because at Central Washington, we try and look at a holistic view of health. A person's, emotions, their behaviors, their physical health, and the medical conditions they have, and kind of help them come up with a plan. So what we're going to do today is I'm going to ask you some questions, get a snapshot of what your life's like, what's working for you, what's not working for you,
Yeah.
and actually kind of make a game plan to help you become healthier today.
All right.
All right, and it'll take about 15 to 20 minutes to get through some questions, and then we'll make a plan. And some people get all the help they need out of one visit, whereas other people kind of come back for a couple of visits to get some more skills. But we can play that by ear and see how you're feeling at the end of the visit. Does that all kind of make sense for you?
Mm-hmm.
Okay.
Yeah.
And obviously, Dr. Ritz said that you have diabetes and that you are now working, and the issue now is that your A1C has been high, or what's going on?
I ended up in the emergency room
Okay.
the other night because I was just really getting dizzy and having a hard time walking because I was about to pass out.
Okay.
And I got to the emergency room and they checked my sugar and it was like in the 500s, and so they gave me a bunch of IV fluids and some insulin, and I'm supposed to be taking an oral medication for my diabetes, but
Okay.
I just kind of forget to do that, and then I need to take care of my diabetes.
Okay. Fair enough. And I forgot to hand you, but this is actually a pamphlet on the behavioral health services, so you can stuff that away and we can get back to the diabetes.
Okay.
You can look at that later.
Right.
So with the situation with the diabetes is you tend to forget to take the medications, and then that's when you're winding up, in the ER and not feeling so well.
Yeah.
Okay.
Yeah.
And how long has this been going on where you kind of just forget about keeping up with the medications?
I don't know. Maybe about the past year.
Past year. Okay.
Yeah.
And does this happen pretty regularly?
Yeah. I probably take them about 4 or 5 days out of the whole week.
Okay.
And, I'm supposed to take metformin twice a day, and I usually will get it in once a day, at least 5 days a week.
Okay. All right. So now I think we know kind of what you're struggling with regards to diabetes. So I'm going to kind of ask some questions about, like I was saying, what your life kind of looks like, kind of get a snapshot of what's going on.
Okay.
Does that sound
Yeah.
okay? All right.
Yeah.
So are you living by yourself right now, or are you with other?
No. I have 2 children at home, and then I actually have a couple of grandchildren.
Okay. Or they're living with you?
One of them is living with us, and then the other child and grandchild are living down the street.
Okay. And so both your children are adult children then?
Yeah, all 3 of them. Well, the youngest is like 18,
Okay.
going to graduate from high school this year.
All right. And the other 2 are the ones that have kids?
Yeah,
Okay.
yeah.
All right. And how old are the grandkids?
One is like a year old, and the other one that's living in our house is a 2-year-old.
All right. I can imagine that can
Yeah,
be
it's a little stressful,
hectic.
but yeah.
Hectic at time. How are your relationships with the people in your house, with your kids? And
It's pretty good, actually. I mean, I really care about them, so
Important. They're important to you.
Yeah, they're really important to me, and especially since my husband died a couple years ago.
I can just tell that he was important to you. And you guys had been together for a long time?
Oh man, probably about 25 years.
Okay.
Yeah.
And that's the children's father?
Yeah.
So I'm sure there's lots of emotions that tend to pop up.
Yes, I try not to think about it,
Yeah.
but it just, just like right now, it just kind of comes out.
Mm-hmm. All right. And right now you're still single and just kind of,
Yeah.
because are you interested in getting back into dating, or is this kind of?
Yeah, everybody's telling me I need to go out and do things, but I'm just having a really hard time doing that.
Okay.
I finally got a job.
All right.
I'm working, and that's kind of cool. I'm working at a school in the maintenance,
All
which
right.
is kind of fun. And so I'm around a lot of kids. It's a middle school, so
All right.
that's kind of fun,
Yeah.
So I feel like I'm starting to move forward a little bit, but I'm just not ready to date yet.
Okay. Yeah. Fair enough. And so you are having more contact with just other people by going to work and everything.
Yeah.
What about friends? Do you have any close support system?
Well, my best, it's really weird. My best friends have kind of moved out of town. One of them moved to the west side.
Okay.
For a better job. And another one, her husband got a better job somewhere else, so they both left Yakima.
Oh man, when did that?
Yeah, it's kind of a bummer.
So your social life is taking a little hit.
Yeah.
Okay. Okay.
Yeah.
And then, what kind of things do you like to do for fun that are relaxing, either or?
Well, I watch TV.
Okay.
There's a couple of shows I like to watch. I do have my favorite soap opera.
Okay. And that's one of the things that helps you relax?
Well,
Or is that more fun?
I don't know if it helps me relax. I guess it just kind of, if I'm tuning in on somebody else's problems, I'm not worrying about my own.
Okay. It kind of distracts you a little bit.
Yeah.
All right. Is there anything in general that you kind of have a passion for, you really like to do?
Well, I guess I used to garden, I had a vegetable garden.
Okay.
My husband and I used to do vegetable gardening. And I haven't really done that since.
Okay.
So I like doing that. It's it's kind of like fun watching kids grow. It's kind of fun watching the plants grow and being able to eat stuff.
Yeah.
And it saves me money.
Well, that's true.
So
Okay. All right.
yeah.
That's sounds like something I might put in the list of things that we might use as part of our game plan. But
Okay.
we'll circle back around to that. We're almost done getting through some of these questions.
Okay.
So how's your sleeping?
It's okay.
Okay.
I get, I usually get at least 5 or 6 hours a night.
Okay. And that's pretty regular like that, or?
Every once in a while I'll wake up in the middle of the night and I have a hard time getting back to sleep. So I'll get up, go to the kitchen and get a glass of milk or eat something I probably shouldn't eat.
Okay. Okay.
Especially because I've got diabetes, but
Yes.
Oh well.
It's not a major obstacle at this point.
No, I don't think so.
Okay. And then, are you using any alcohol right now?
No, I had problems with it in the past, so
Okay.
with my husband dying, I knew it was kind of going to be a dead end if I started drinking again.
Okay, great decision.
So, yeah.
Really good insight on that one.
Yeah.
And no drugs?
Uh-uh.
All right. Cigarettes?
Cigarettes?
A few?
Still, yeah.
How many out a day?
I'm probably at about 3 or 4 a day,
Okay.
which is not bad. I used to smoke a pack a day,
All right.
so I
And-
thought I'd end up doing more, but I've stayed able to kind of go down.
All
I
right.
don't want the kids and the little ones to be exposed, so.
So all the way down to 3 to 4, that's really good that you cut down that much. And what about caffeine, like couple cups of coffee?
Yeah, like anywhere from 2 to 4 a day. I like my coffee.
Okay, and at this point, you feel okay with that, not too jittery with that? Well,
Not at all.
all right. All right, and we mentioned, or you talked a little bit about your diet, that, there's some night eating and maybe not eating all the things that maybe you should. How in general is it with regards to getting some fruits, vegetables, whole grains, that kind of stuff?
Well, I like oatmeal, so I'll eat oatmeal for breakfast. When I eat, I don't always eat breakfast. And then lunchtime, I'll make a sandwich.
Okay.
Sometimes I'll eat an apple or something like that, with lunch. And then dinner, I'll usually cook a vegetable, a potato, and a meat. Kind of have dinner for the kids and me.
So you're eating pretty well.
Not too bad.
Okay.
I mean, I wish I could do better with the, more fresh stuff, but maybe now that I've started working again, I'll have more money to work with,
Okay,
so.
fair enough. So I've heard you say a few things, so I want to kind of check in with you.
Yeah.
So one is that you do eat pretty well, probably can make some improvements, so that's maybe something we keep in the back of our mind.
Yeah.
But also, there's a lot of where you're not taking your medication.
Yeah.
You're doing it 4 days out of the week or 4 or 5 days out of the week.
Yeah.
And then the other thing that you kind of mentioned a few times since we've been talking is that sometimes some really difficult feelings and emotions tend to pop up.
Yeah.
And it kind of, in those times, you kind of distract yourself or try and think about something else, which is actually a really normal human reaction, but maybe it's not always the most effective in getting where we want to be. So what do you think are some of the obstacles with taking that medication? Do some of the thoughts pop up and bully your mind a little bit, or what's going on?
Oh, I don't know. Sometimes I just get, this is really hard to say.
Okay.
Sometimes I just start feeling like, it's not worth it.
Okay. So you have the thought that actually comes into your mind and just, it's not worth it.
It's not worth it.
But taking care of yourself?
Yeah.
Okay. And even right now, I can kind of see you, it doesn't seem like it's the most comfortable thing, like you said. It's hard for you to even say. Your body's kind of showing me that it's kind of hard to say, but you said it anyways.
Yeah.
So I appreciate you letting me in on that. What other things are kind of going through your body as you even tell me?
My palms are sweaty. I just really feel sweaty, and I guess I kind of feel tight.
Yeah.
Like that. Yeah.
Does that happen often throughout your day? Or kind of?
I don't know. I guess I don't really even notice it so much.
Okay. Yeah.
I kind of feel numb a lot.
Yeah. Yeah. And like you said, a lot of times when you'll start feeling some emotions or you'll start thinking about your late husband, your natural reaction is to kind of think of something else.
Yeah.
Or tune out.
Yeah.
Okay. And how does that work in general, like the tuning out? And is it kind of...
Kids come home.
Okay.
I feel better.
Okay. So it works in the short term, but these type of emotions, they kind of pop up out of the blue.
Well, I still live in the same house, so, I'll see the different things in the house that remind me. And, what'd you ask me?
Just about being distracted and that...
Well, when that thought comes up, it's not worth it, I guess I get scared.
Okay, yeah.
And so that's why I distract myself with the TV and the soap operas, because, like I said, if I worry about somebody else's life, or if I'm kind of involved in theirs, then I don't have to have those thoughts.
Yeah, and in that moment, when you turn the show on, you're able to distract yourself, it goes away, the thoughts, right?
Yeah.
Okay. And the kids come home, and then the thoughts are still gone, and you get happy.
Yeah.
But then you're going about your everyday life, and guess what pops up again? Is it this more difficult thoughts?
Yeah, it's, the sadness again.
The sadness.
And then just kind of, the sadness just kind of, it feels like it just spirals
Okay.
to the point where it's not worth it. And, I kind of know deep down inside, I don't want to kill myself.
Yeah.
But I feel like if I don't start managing my diabetes, I am, killing myself.
Okay.
And I want to be around for the kids.
Yeah.
So I guess that's why I'm here.
Okay.
Yeah.
Well, I think you made the right decision in coming in and talking about some of this stuff. This is some important stuff.
Yeah.
And like you said, the distraction only works temporary.
Yeah.
And then here we are.
Yeah.
And then, like you said, it almost spirals.
Yeah.
So naturally, as humans, we don't like to be in pain, right?
Right.
We like to, when we get upset, we think of something else.
Yeah.
Yeah. So that's why we're gonna have to get a little bit counterintuitive.
Yeah. Okay.
So I have a couple of ideas of what we can do to help you kind of get more in touch with some of these thoughts so that they don't push you around. As a kid, did you ever play with one of those Chinese finger traps?
Yeah.
Okay.
Yeah.
And what happened with them?
Well, if you try to pull out of it, it just gets tighter and tighter and tighter.
Okay. So the harder you pull,
Yeah.
the harder the grip becomes.
Yeah.
All right. And how do you get out of the Chinese finger
You
trap?
just let it, you loosen up and let it go.
Okay. So you just kind of allow your fingers to be there and
To
just
relax.
kind
Yeah.
of gently pull out, and then all of a sudden, whoo!
Yeah.
But if you tear, you're stuck.
Yeah.
Okay.
If you try to force it, it doesn't.
Okay. So using that same idea, but only with your emotions. What happens when you resist? You distract at all costs.
Well, I guess I don't feel it. I don't feel so bad because I don't feel at all.
Okay, you don't feel it all.
But it hasn't, I guess, I don't know, I guess it's, I guess it doesn't work in the sense that my feelings are kind of as strong, it feels like my feelings are as strong as they were like 2 years ago.
Okay, the grief feelings for you.
Yeah.
Okay. So in some ways the grief is still there, and then in other ways you don't feel it all.
Correct.
And you seem like a pretty loving mom and grandma,
Yeah.
and your feelings are something that are important to you.
Mm-hmm.
To be able to
Yeah.
show love.
Yeah. Yeah, that's true. I guess I would probably be more attentive to the kids if I were more in touch.
Yeah.
Because my mom had problems with depression, and I could tell when she wasn't doing well because she just wasn't there. I mean, she just wasn't. She was physically there, but she wasn't there.
Yeah.
And that's true. I don't want to be like that.
Okay. So I have an idea of a little exercise that you can maybe even try. Well, you should try outside of the visit.
Yeah.
It's about, I got a pen, I do. So, like we're talking about, if our natural reaction when we feel something difficult is to turn away from it, and like our Chinese finger trap, to turn away from it and pull out, and it gets us stuck more and more, and it has more grief, and then to the point where you're not even feeling anything.
Yeah.
The opposite, and how to let your fingers out, is to like actually experience whatever you're experiencing.
Okay.
Allow whatever pops up into the mind to pop up.
Isn't it going to make me feel like I might want to kill myself? though, if I'm feeling that sad?
I mean, with this, you're going to get to the point where you'll be able to see that thoughts are thoughts and feelings are feelings. And you'll be able to get better in touch with what you want. And at this point, you want to live, correct? You know,
yeah.
I was going to say, I got that sense that your
yeah.
kids, you have a lot to live for.
Yeah.
And so we want you to be in charge of what you do and not whatever's running through the mind.
Mm-hmm.
You know, because we all have different thoughts, we all have different feelings pop up. And at the end of the day, we want you making the decisions, not a thought.
Mm-hmm.
So you'll be able to actually kind of learn, like, you know, who you are is different than the thoughts that necessarily pop up into your mind.
Okay.
It's kind of like, almost like a computer screen, like you are the person looking at the computer screen, and what comes across the computer screen is your thoughts, your emotions, your memories, and then there's you looking at it, and you can make the decision of what you want to do with that information.
Huh.
So what I'm thinking is, when you know you're going about your day, what I'd like for you to do is to kind of do a little check-in, and we call this acronym is called TEAMS. So the T is for thoughts, the E is for emotions, the A is for associations, the M is for memories, and the S is for sensations. And what I'd like for you to do is not a time that you're really feeling down, just a time when you're content.
Okay.
I'd like for you to do a little check-in, and this could literally take 30 seconds. So like a little 30-second check-in, and literally ask yourself, what kind of thoughts am I having?
Okay.
What am I feeling? You know, what kind of emotions are popping up? Is it being content? Is it being happy?
Okay.
Is it worrying? I don't know, maybe you're worrying about something. Are you thinking of any memories? And then kind of what's going on in your body. Like, are you tense?
Mm-hmm.
Or are you relaxed? Because, you know, when I asked, you know, do you get tense often? You know, you weren't really sure. So this is kind of a way to check in on that.
Yeah, okay.
And so I'd like you to try this and practice this when you're just going throughout your day. Is there a time, like in the morning or in the evening, when you have a little bit of time to yourself? You're not at work, or you're not fixing breakfast?
Yeah. Probably just before I go to work.
Okay.
Because the kids are usually out of the house, and then the house is a bit quiet, and then I go to work.
All right.
So later morning.
So I wrote that down on this on the sheet. Is so before work on a daily basis, you'll do, you know, a 30 second to 2 minute check-in. And if you're willing, I'd like for you to actually write these out and write what thoughts you're having.
Mm-hmm.
Even if it's like, okay, I gotta get ready for work, or I'm leaving in 15 minutes, the emotions, whatever pops up.
Huh. Okay.
Happiness, content, excitement, frustration, whatever pops up is okay. And just write it out. And if there's any memories that pop up, you know, if this is, whatever gets across that computer screen and shows up, I would like for you to write it down.
Okay, cool.
And so this is going to give you some practice, so that when we can actually have you do this when you are kind of really feeling down. All right?
Yeah.
And so you're going to practice this when you're just going about your life, and then to the point where you can actually practice this when you're down.
Sure.
And we want you to get to the point where you're kind of in tune, so that with your medications, you'll kind of be a little bit more tuned into actually what's making you show up and take your medication, and then what's maybe an obstacle.
Mm-hmm.
Because you seem like a pretty resourceful, smart person. You go to work every day.
Mm-hmm.
You know, forgetting to take your medication, you know, like the doctor said, you know your medication routine.
Yeah.
So we want to see if maybe there's something in the mind that's bullying you into not taking your medication, and see if, like, having those thoughts of, you know, this, or what was it, what's the point?
Yeah.
It's not worth it.
Yeah.
We want to kind of actually distance ourselves and allow you to see that thought for what it is, and that's a thought.
Yeah. Okay.
So it doesn't bully you into not taking your medication.
I'll try it.
All right?
Yeah.
And so I'm actually thinking, and see if you're okay with this, when I know you have an appointment coming up in, I think, 2 to 4 weeks with the doctor.
Yeah.
Would you like to just kind of meet with me on that same day?
Yeah.
And we can check in on this, and
I got some homework, eh?
yeah, do step 2. Do step 2. So I'll put the follow-up on here for 2 to 4 weeks, and then have it the same day that you meet with your PCP.
Okay, that sounds good.
All right. Any questions or thoughts?
No, this is kind of interesting.
Okay.
You know?
It's an experiment.
Yeah.
In fact,
Okay.
you can write whatever comes up. I'll be interested to see, and then just bring it back with you.
Okay.
And you could use another
Great.
piece of paper.
I'll probably get a notebook.
Yeah.
All right. Well,
Okay.
thank you so much.
Good to meet you.